yes, we're going to alternate in delivering the presentation. So we'll tell you all about our own organisations, but of course, through the Community Fund, we're being funded as a partnership, which will support us and help us in making the best possible offer, we hope, for yourselves in terms of the capacity building support, the fundraising support, the networking, the volunteering, all of those infrastructure services which we hope will support you in doing the best possible job. That's, I think, how we see our role. We want to get the best out of Croydon's voluntary sector, and I think there are two big things that the Community Fund support us in doing over and above the specifics of the services you provide. Firstly, I think Croydon Council's support, they've always been a very strategic supporter of the voluntary sector. It enables us to leverage funding in from elsewhere. I think increasingly through our partnership work, that's what we're able to do. Secondly, we hear a lot about transformation. I think we've got a central role in transforming health and social care, in developing that public health approach we talk about. And that's our ability to unlock the potential of communities. I'm quoting from the One Croydon Alliance literature here. That's what we'll hopefully support you to do by acting as a partnership. We all have different strengths and specialisms that we can bring to your support. That's what we'll tell you about now.
As we cover the whole borough, we know that there are less services in the south of the borough, but we aim to tackle those through outreach and locality-based work. And there's also a pie chart there to show you the size and the share of the contract. So the objectives of this programme are really, the first is capacity building and support. That includes premises. So that can include things like one-to-one support and advice sessions, locality-focused events, training, and identifying deferring needs. A clear published offer to the VCS and providing premises-related things like reviews to identify which groups are underrepresented and how to access them. Network events with active engagement of minority groups. Monitoring of infrastructure services to identify access by monitoring groups, and peer support mechanisms across the sector. The last one is information on services. So that can include things like newsletters, events, and general communications. Keeping up to date with the VCS content in the council's e-marketing place, which is going to feature a major thing in this part of funding. And also to work collaboratively with Croydon Digital Services and Health and Wellbeing and adult commissioning departments to ensure the e-marketplace is a good quality place to be.
A little bit about Croydon Neighbourhood Care Association. Really pleased to see loads of our members in the room, so I'm really pleased that you were successful with your bids. We were also successful with some of our other strands of work as well. For those of you in the room who work with the over 65s, who are not currently a member of ours or have recently got some new funding, look forward to you joining us. We're based in a very beautiful old building that belongs to the local authority down in Freemasons Road. It's been under scaffolding for a couple of years, but it is a very beautiful building. And we have a whole range of different kinds of support, exactly the same as all of our other partners.
The main thing that we're going to be doing over the next 3 years directly is we've now taken on a new building in the Whitgift Centre called the Wellness Centre. We will be taking on another building called Soccer Cheetah by end of the year as well. And we're hopefully going to be doing more work in the new Annington area and more work in the south of the borough as well. So the idea is that the BME4 wants to increase its membership from 2,500 to 5,000 in the next 12 months. And by doing that, we know we need to go out into the community and do as much work as possible.
Not exclusively, but in particular for Asian communities, because it's been identified that they have specific cultural needs and language needs that need to be serviced by people who are from similar backgrounds and similar cultures or have experience of delivering those services. We have been delivering support services that I outlined, all those things about the fundraising support, the monitoring evaluation support, the training support and all that, and we continue to do that. But we also have a contract for health and wellbeing, which we're working in partnership with other community groups to deliver that. all of our information is available on our website on what we deliver, because it'll be a long list to go through now. But what I'd really like to say is that we're open for business. We're welcome to all communities. We do serve the Asian community, like I said, mainly, and my colleagues cover the rest of the communities. But if you'd like to come and talk to us, my colleagues are here and happy to tell you more about our services.
Croydon's voluntary community and social enterprise sector. Sue mentioned strategic views. I think one of our responsibilities as an infrastructure partnership is to provide a strategic support, not a strategic lead, but a strategic support for you all. What we're always trying to do, aren't we, is to align our work with our funders' priorities. And I think through this community fund exercise, we've been invited to do that in the best possible way, because there's a lot of consensus, I think, around the themes that were chosen for us to deliver against. But what, of course, is very important for us to do is to make sure that we're representing the needs and the priorities of the communities we work with. So that's the first point I'd make about CVA's support. We've, since 2010, invested very heavily in our asset-based community development work. And when I look at the One Croydon Alliance and the transformation of health and social care, and the role that it sees for the voluntary sector in working with local people to find their own solutions, to develop an interdependency within communities, not a dependency, then I see the role of infrastructure in working with you all to unlock that potential that I talked about earlier on as much as you can. We, through our ABCD project, support what we call community connectors. Now, that's another word for volunteers. Volunteering covers an increasingly wide spectrum, I think. Again, it's so essential that we provide you with support to work with Croydonians, not just as volunteers who help deliver services, but work in the community in all sorts of informal ways. But we do have the Volunteer Centre at your disposal. We support specialist volunteering roles like, for example, the appropriate adult role, so that's supporting young people, vulnerable people in custody. And as an accredited volunteer centre, what we'll do is broker volunteer placements for your organisations. We'll also support you to manage volunteers as well as you can. That leads me into the capacity building piece. Training is going to be available. So, for example, on safeguarding, we'll cover levels 1 to 4. Doing a lot around quality controls at the moment. Another requirement that usually comes with funding is to have that quality assurance in place. So we'll support you on that. The last two areas I'll mention for CVA are around networking and partnership. Again, I think if we as a sector are to do our best, we need to share information at meetings like this. It's what we're very good at. But we are also good in networking, at putting partnerships together. My point earlier on about external funding, we want to support you to work more in partnership to deliver services and to access funding in doing that. Partnership is the last theme. We're a partnership in front of you today. We will work very closely to make sure that you get the best support available, but we'll also be working with you all to develop partnerships. We think that's the way forward for organisations to work together in developing partnerships that meet the needs within the communities that we all serve. Thank you very much.